The pandemic has created shortages of some medications since it began, initially related to panic buying. The most commonly used antidepressant in Australia, sertraline, is one of many such as the brand Zoloft, that have been affected by a global shortage. Olmesartan and irbesartan, both blood pressure medications, were short in Australia, as were hormone replacement therapy, HRT, patches, and carbimazole, a thyroid medication. As of February 2021, the contraceptive pill norethisterone was hard for pharmacists to acquire. Supply had been intermittent for 6 to 12 months. Shortages of Norimin and Brevinor, both Pfizer products, were reported in August 2020 and first predicted to last until December 2020. The shortage was then expected by the TGA to be resolved in March or April 2021. In the case of sertraline, a Serious Shortage Substitution Notice, SSSN, was issued by the Therapeutic Goods Administration, TGA. SSSNs were also issued in Australia for Prazosin, blood pressure, Metformin, diabetes, and Estradot, HRT, which in theory allows substitutions like issuing twice the number of 25 mg, 0.39 grains, tablets in place of the prescribed 50 mg, 0.77 grains, tablets, without a new prescription, but with the patient's consent. Chris Moy, Vice President of the Australian Medical Association, AMA, said medicine shortages in Australia were a pre-existing problem before COVID-19. I think somewhere in the order of 89% of all day-to-day prescription medications are supplied from overseas. They often say patented in Australia, but they are actually made overseas. Moy also said a lot of our medications are made in China and India. Sovereign capability in protecting supply of our medications is something that should be seriously considered. The TGA gave short-term approval for the import of some medicines that are not on the Australian Register of Therapeutic Goods, ARTG, that are approved for import and supply in Australia because there is a shortage of a medicine registered in Australia, and the medicine is needed in the interest of public health.